Yeah, so hello, everybody. My name is Shaloo Choudhary, and I'm an occupational therapist. I've been a therapist for the last 30 years, and right now I'm working primarily in Piscataway, and I'm very appreciative of your audience. And I'm grateful to Piscataway Library to giving me this opportunity and portal to help spread awareness about, breast cancer rehabilitation. Being October, the Breast Cancer Awareness Month, so I think it's fitting to help with the community. So I'll start my presentation. I'll start it with one of my favorite quotes by Dr. King, that if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, we have to keep moving forward. And that's what I feel, when, we're trying to promote rehab or anything, like when somebody is diagnosed with cancer, any form of cancer, breast cancer, any form of cancer. I mean, there's a lot to take on, but when the plan of care is being established, we want to make sure that the people are aware, whether you as a survivor or going through it, or the family member or friends, that what are the other options which are available to help minimize the symptoms. So we'll talk about that. I do have a disclaimer that this presentation is provided for educational and information purposes only, and I do not have any financial disclosure. So, like I said, this is Breast Cancer Awareness Month, October, and I wanted to do an awareness campaign about the breast cancer rehab. So that's the whole purpose of this talk, to educate and spread awareness about breast cancer rehab. Rehab is available during any stage of recovery of the process, whether somebody is newly diagnosed or they are going through the whole treatment process, or they have gone through it and it's been a few years. The rehab can be helpful at any stage of recovery. And I also wanted to reinforce the importance of reaching out to healthcare providers and get help to lessen the after effects of cancer, whether it's the medical treatment or the radiation or the surgical treatments. Now, having said that, a lot of people ask, what's the good time to ask for rehab? And I do understand, just dealing with the cancer diagnosis and the medical side of the treatments, it's not easy. There's a lot on the mind. But we also have to be aware of all the after effects, or some of the after effects that can happen. So what's the good time? Anytime during the journey. There's never too late, never too early. Anytime when you feel the symptoms are not right, or if you want to do a little bit more preventative or proactive approach, then anytime is good time. And so what the cancer rehabilitation can focus on? Now, I have listed few things. I mean, they seems a lot, but that doesn't mean that everything is applicable to everybody. But it can be, some of things could be applied, but I just wanted to lay it out. So the rehab process can help with the cancer related fatigues. It can help with the weight loss and general weakness, lymphedema. I'm not too sure if, most of you have heard about this term, but that's the swelling which happens in arms. Now we see it in chest, breast, or in abdomen, sometimes in the armpit, sometimes going through the neck or the front of the shoulder, back of the shoulder. Now, it's not an uncommon side effect or after effect of the cancer treatment. It's fairly prevalent, and if detected early, we can prevent the severity of it and we can help manage it better. So the next area where the cancer can focus, or cancer rehab can focus, is on the scars. So after the surgery to remove the tumor, or if there's any reconstruction being done, or the drains were done, the scars sometimes can get sticky, or they can get, very sensitive. So therapy can help. Then also therapy can help with the skin and tissue changes after the radiation. With the radiation, the skin changes, it becomes very tight. Everything, underlying tissues, the muscles, the joints become very tight. So it can help lighten that up. And so if somebody is going through surgery and they're going through a reconstruction, then therapy can help adjust to the new normal. What I mean by that is, depending on what kind of surgical reconstructive procedure somebody's going, there's usually a donor site where the muscle or the flap, that we call it, the skin has been taken and it's been reapplied to the other part as a reconstructive process. So we need to help restore that balance, because from one part there is a missing component, the other parts it's being added, and where it's been added, the part has been removed. So there's a lot of consideration. So therapy can help with that adjustment, because it could be pain, there could be scar, there could be just a body mechanics issue or ergonomics issue or just strength issue. So we can assess it and help you recover better. Then the nerve damage or neuropathy, it could be a side effect of chemotherapy, radiation therapy. Sometimes the nerves are just involved in the whole diagnosed cancer process or anything else. So the sensitivities could change in the hands and the feet. That can lead to balance issues, falls. So we can assess that and help. Everything leads to body image issues, just going through the cancer treatment, with the weight loss, with the hair loss, if somebody's just going through surgery. So there's a lot of body image issues, coping issues, stress management. So therapy can help focus on that. This way, the daily activities of living become a little bit easier, and then we can help modify those too, and help manage the fatigue, and help manage just the ease of our life roles. Then therapy can help get the compression garments, and I'll talk more about it. And after the therapy ends, it's important to keep a continuum of care. So a lot of time when somebody goes for therapy, the therapist gives a home exercise program. But what in oncology we try to do it, or anywhere in therapy we try to do is to find a continuum of care. So maybe once the therapy is finished, as a part of the self-care or self-management, the patient is being referred to a cancer wellness program, which is run by exercise physiologists or personal trainers who have background in that. So there's a continuum of care. So there's a safe transition to the exercises, to the gym-based, community-based exercises, versus just going to the gym and just, wondering like if I'm gonna get hurt or not. So, as I said, I like it. My personal approach, and which I tell my patients is I really believe in preventative measures. I believe in proactive versus reactive. And with the clinical experience, I've noticed that the people who start early, or they have a better handle on the disease, or how the plan of care is going, the recovery process gets a little bit easier. So is it possible for a patient who is newly diagnosed to see a therapist before any treatment, medical treatment, surgical radiation? Yes, absolutely. We see it. Does it happen that often? No, it doesn't happen that often. It should be part of the early, the pre-admission testing stuff. But I think if somebody comes to me who is being, he's going to start the treatment, what would I do? I probably would do a recording of the baseline arm girth or the chest girth measurements. Maybe I can look at the posture. Maybe I can look at what other limitations they have, which were pre-existing. So when we're designing the plan of care after the fact, then it's easier. Then we have a baseline, and then we can go forward from that. Because, as I said, the lymphedema or the swelling is one of the main things which we have to keep it into consideration, or skin changes or posture changes. The other thing which a therapist can do, if somebody is seeing them early on, is educate. I think take the opportunity of doing the education. We'll make sure that the patient or the family is aware of the importance of moving the affected arm and trunk. Then also taking care of the skin care during and after the surgery or radiation. Now, the skin changes happen during radiation. So radiation oncologists, they're on top of their game. They usually tell the patients how to take care of the skin. But as a therapist, I can help my patients to select a better clothing or a different clothing if the sensitivity is appearing, or maybe show them some flexibility exercises so they don't end up with that stiffness pain as it happens sometimes. I can educate my patients about fatigue management and how to modify the activities, how to conserve the energy, just like a home environmental modification, or even just clothing modification, just making them aware, in the beginning, if somebody's going for surgery, it probably could be a little difficult to do overhead task, or putting, a shirt or t-shirt over. So maybe a button down shirt, or maybe contrasting bras. So things like that we can suggest. So these could be part of the education, but also what is done is like we have established a relationship together. So if it need be, so then as soon as the therapy is warranted, we can start the treatment. Now, this is like if somebody has just been diagnosed or they started the medical treatment. In case of the surgical treatment, the therapy can start as soon as like the week 1, as soon as the drain removes, the patient can start some treatment. So we can minimize these effects. Again, it like as how you feeling about it. So before I go back, before I make the next slide, so the next few slides, in my clinical experience, I've seen few after effects, which are most commonly seen, or most commonly, those are the reasons why patients are referred for therapy. So I just wanted to bring some light to them. Again, not everything is happening to everybody, but still, they're commonly seen. So first one is the surgical scar. So I just wanted to bring attention here. So this is a scar which is not healing well. It's a little bit overgrown. Like a lot of time the scars, they heal okay, but sometimes the scars, they become very sticky, they become very sensitive, or they're just, overflowing. So there's a scar for the surgery. There could be a scar for the drain. If somebody needed a breathing tube, so there could be scar there. So, or reconstruction. So the scars can be there, and then that can lead to stiffness, and that's the next point, that it can lead to not just the scar, but the whole treatment itself can lead to pain, loss of flexibility, strength loss. So you can have some joint stiffness, muscle stiffness. The other possible side effects of cancer treatments could be, if somebody's going through radiation, if the skin changes from radiation. There's a discoloration in the skin. With the radiation, the skin sometimes peels during the process. So there's a healing. So you have micro scarring, which is happening. And the skin becomes very dry, and it tightens up. And sometimes if it's untreated, or if it's not healing the right way, the skin becomes very thick, like leather-like thick skin. So, so educating the person, making sure that this person can deal with it, or like, help minimize. Now, these are all things, like anything which is being addressed early on, we can manage it much better. We can reverse it a lot. The other thing is the lymphedema, which is the swelling in the arm. Now, this is obviously, it's a severe case of lymphedema. Hopefully, we'll never reach this spot. That's why I want to address somebody's limitation of surgery, especially if the lymph nodes have been involved from the armpit or from the breast. The lymphedemas can happen. Now, this is in the hand and the arm, but lymphedemas, we see it in the armpit. These days, there's a lot of breast conservation surgeries are happening. So I see a lot of lymphedema in the breast, in the chest, in the shoulder blades, in the back. I get patients who feel that their swelling is coming up all the way up to the collarbone. It could be in the abdomen, depending on like how extensive these surgeries were. Even if the lymph nodes are not involved, I've seen it, like there's an incidence of lymphedema with the sentinel node biopsy too. So just keep it into consideration. If the swelling is there, just bring it to somebody's attention. Now, all those things, can lead to body image and coping issues. I know when it's so hard to be in the patient mode, and everybody's trying to, like cheer us up and like, stay positive, be positive, but sometimes that does not work. We are dealing with it. So there's a high-low moment. So it's really important to recognize and acknowledge how one feels, to understand what are the levels of anxiety and how it is affecting somebody. It's essential that a rehab professional, whether it's the physical, occupational rehab person or a mental health person, help this person or their families adjust to the new normal. So, seeking appropriate providers, mental health providers for oneself, family is very important. And then also knowing what are the support groups and resources available in person or, these days, like virtual. So really important to do that. Now, I want to take a pause here. I know this is like I gave a lot of information, and also if somebody's going through the treatment, has gone through the treatment, have seen, or they've seen their loved one going through it, just know, this is a lot of information. So I just want to like pause here, and then I want you to take a pause and just give yourself time. I think, as a therapist, we recognize that the patients who are coming our way, it is so hard to be in the patient mode. You require a lot of patience. Things are changing and things are changing rapidly. So just take a breather and, see what you can do. If you're aware of it, then you can talk to your doctor. The next few slides I have is to, in the meantime, you are reaching out to the healthcare providers or, finding a therapist near you. I just want you to be aware of it and maybe give you suggestions about self-management. So I'm going to share those slides with you. So if nothing we can do or nothing is helping, I think we can start with the breath work. So in yoga, the breath is called prana, which is the life force. So we can't do anything, we need to breathe. It's so important to realize how our breathing patterns get altered when we are sick. We're doing a lot of shallow breathing. So just establishing a rhythm and a pattern, I think it's important and the right way. So we're not doing just the shallow breathing, we're just doing a belly breathing. So if you're familiar with some deep breathing exercises, do that. If you do some yoga Pilates, you probably learned something. You probably heard about the belly breaths or, the smell the roses, blow the candles, or even like the box breathing where, you visualize it that you breathe in for maybe 2 seconds, hold that breath for 2 seconds, breathe out for 2 seconds, and then go back. When I say hold back, it's not like I'm holding my nose and holding my breath. Is just I'm making sure that if I breathe in, I just have a little hold in there and then I breathe out. The one breathing which I really like, and I usually get my patients started, is the nostril breathing. So just resetting the body and resetting the rhythm. So what I generally do is I tell my patients to just gently block one side of the nostril and breathe in and out through the other one. So maybe 3 to 4 times or 5 times, and then do it in the opposite way. So just to get the rhythm, just to get an idea about how the pelvic floor, the diaphragm, the neck muscles, everything come together for breathing. And breathwork has a lot of research and there's a lot of evidence which supports that diaphragmatic breathing has a strong correlation with the stress management and with the lymphatic flow. So if we're concerned with the swelling, this is a natural way of enhancing the pumping. It helps to strengthen the immunity. It helps to remove the toxins. So I think if nothing we can do, this is something where it could be very, very helpful at any stage. It's also a core exercise because you're engaging your pelvic floor muscles, your diaphragm muscles. So it's a core exercise. So you're starting the strength process right day one. It triggers the body's relaxation responses by regulating the autonomic nervous system. It helps with the physical and mental health and also helps improve the sleep quality. So, by all means, get started with some breathing exercises. The other thing is the lymph management. So here I wanted to stress it out, that's something, it's being done by therapists who are certified in the manual lymphatic drainage. There's a special kind of massage that can happen. But if you have gone through, just recognize that sometimes if somebody has a surgery or radiation, some of the swelling is normal because, that's the healing swelling. But if it stays longer and it's getting thicker or it's the part is getting warm or is it painful or is getting tight, then you need to address it and then make sure that that's not turning into lymphedema. If there's a lymph node compromise or disease process, that can cause that too. So we just need to address it. Early intervention helps to really manage this much better. So while you get recognizing that, make sure you find specialists in your area or talk to the doctors. Maybe they know somebody. So when the therapist sees you, they can work with you with this special massage technique, the decongestive manual lymph drainage. They can help you get the medical grade compression garments for the arm, for the hand, for the breast, for the chest, even for abdomens. Sometimes if somebody has gone through reconstructions, we order the pelvic garments. So so that's a very custom garments. There are the certified fitters, the mastectomy product fitters, which have the specialization in it. So usually, we can connect with them. They can help put the state-of-the-art compression garments. There are also specialized quilted garments to manage the swelling and skin changes after radiation therapy. And this is a long-term management we're talking about. There are also different kind of bras, compression bras, which are available. They're different from the sports bra, traditional sports bra. They could be used after surgery or during radiation or lymphedema or just managing the overall long-term effects of it. And they can also, like in those bras, somebody can also fit in the prosthesis or if there's anything else they needed. Now, with the radiation, if somebody is going through radiation, during currently, or they have done the radiation, just know that the skin changes happen. The skin becomes very dry and it's very fragile during the treatment. Sometimes the skin stays very fragile, very sensitive. So the selection of clothing is crucial. Maybe, choosing the natural fibers in the clothing would increase the comfort, like cotton, jute, rayon, bamboo kind of material. There are a lot of fibers which are available. Also to protect the skin against the sun. So radiated skin and sun don't go well. It does not like it. So you have to make sure that you're protecting it against the sun rays. So using the SPFs or the UV garments. So those are helpful. Dry brushing can help minimize the sensitivity, but also to increase the lymphatic flow and or the blood supply. And it's important to keep it hydrated. But what I mean by hydrated is because the radiated skin or the tissue is going to just get tightened and tightened and tightened. So it needs constant stretching. It needs to be moisturized. So make sure if you decide to use a moisturizer, use a non-scented, very less chemically inclined moisturizer, or maybe just used a natural organic cold pressed oils. There are coconut oils, there are sesame oils, there's vitamin E oil. So there's a lot of things which are available online or in the market or in the stores, which can be helpful. And also, if you see a therapist, maybe they can help you design a flexibility program during radiation that can help with the tightness. Now, the pain, stiffness, and fatigue. So I feel like they kind of go hand in hand with each other. So there's a fatigue, persons are not moving. So they're getting pain, they're getting stiffness, and then kind of just go into the vicious circle. So one can lead to the other. Person can have all three factors by itself or one, two or one, but usually they kind of go hand in hand. So what I generally suggest my patient is to, make time for a regular, gentle, pain-guided exercises. When I say pain-guided exercises, it's just respect your pain, do what the body allows you to do. So just any which way, just move. If some exercises, do the exercises, or just move the body part. Walking is a good way of, doing aerobic activity. Sometimes patients just need a stress buster and then like dance or anything which allows us to move, but in a very structured, pain-guided way. I think that's helpful. And any of these activities, even walking, can help with the cancer-related fatigue. So, it's a win-win situation. And I think I'll end it here. This is my contact information. If anybody has any question, feel free to email me or reach out to the library. They can direct me. I work in Piscataway. And I am going to, before I end it, I'm going to leave, I'm going to open it up and see if anybody has any questions or concerns or comments that I can answer. So feel free to either say it or put it in the chat box.
Thank you so much, Shaloo. As usual, I am blown away by your wealth of information. So yes, please, everyone, take the opportunity and ask your questions now.
And if nothing is coming to mind, just feel free to either put in a chat box or reach to Karina. She can forward me or, email me directly, whichever is easier.
All right, there doesn't seem to be any questions. Oh, here we go. Is olive oil okay as a moisturizer?
Yeah, I mean, why not? I generally look for anything which is more natural based. So yeah, olive oil, if nothing is available, I'll just put olive oil, but make sure it does not have anything infused in it,
Okay,
just plain. Yeah.
Does that mean you can't put garlic in the olive oil?
I was thinking of the same thing. It's dinner time. Yeah. We can put, not to rub on the skin.
All right. If there are no other questions, then thank you so much, Shaloo. And thank you,
so
everyone.
much. Thank you. I really appreciate, your audience and, for Piscataway Library for giving opportunity, because we're all working towards the health promotions of, different diseases and help manage it and make community aware of it, especially this pandemic time. I think it's really important that we just don't neglect any symptoms which are not, jiving well with us. So thank you. Good night. Stay safe.
Oh, we do have one more question.
Okay.
Are there any specific fabrics one should avoid?
So a lot of time, I see my patients during radiation. So I think most of them complain of anything which is tight fitting. So that's not the fabric, but like polyester, nylon kind of texture, like anything has a silky component, like anything which slides, I feel like, it does not absorb the sweat as much. So those are things to avoid. But it depends on skin sensitivity. So a lot of my patients just wear cotton, or I suggest them to wear cotton if the radiation is affecting the skin or is peeling it. Yeah. So synthetic stuff, probably to avoid.
I have another question. It's been me the whole time, but I can't type fast enough. And I know you're hungry, so I'll try and be quick.
No, I'm not hungry.
So the radiation levels, should a person who is a carer for the affected person be concerned about I mean, I remember seeing then sometimes they say that people shouldn't share a bed, or that their children shouldn't hug them, things like that. So should a carer be concerned with radiation levels or anything like that?
No, I don't think so. It's that kind of radiation, not the radioactive radiation, which, permeates to other body parts. There's no cycle like that. I have not seen it. Or I've not heard of anything about it. So these are medical grade radiations where the radiation oncologists have, decided and, worked on that. And usually it's a small, like 15 minutes treatment or 20 minutes treatment overall. And so patient comes out. I see patients all the time from radiation. They get the radiation and then come see me. So I'm not aware of anything like that. As far as hugging is concerned, it depends on how the skin is. A lot of time patients are a little bit more sensitive where the radiated area is. So maybe it's peeling or is just not feeling well. So they avoid that physical touch, but there's no contraindication as far as I am aware of.
All right, thank you.
All right, thank you all so much for coming and joining us this evening.
Thank you.
Have a good night.
Good night, everybody.